the blood pressure because it doesn't know when it has to basically turn on and turn off. So by relaxing the body through doing things like acupuncture and even Chinese herbs that work well with the things that Dr. Roselle just suggested, essentially it would kind of tone the body back down. That way you would also know, too, if you're having a stress response and the blood pressure is going up because of that, or working on other organ systems that may create problems later, like the liver itself.
Just a real straight-up question. How much water do you drink a day?
I don't know, maybe a liter.
Okay, so how big of a man are you? What's your weight?
240.
Okay, so you need to take that liter and triple it.
Okay.
Take it up 3 times. And you want to get about 90 ounces to 100 ounces of water. And you'll find just by doing that, you'll increase kidney function and urinary flow. Kidney is one of those organ systems that will decrease blood pressure. It has these valves called DCTs, or distal convoluted tubules, that they're the end piece of the kidney where filtration takes place. And if they're working the way they're supposed to, because they sense a lot more fluid, they dump the pressure in the system. So you may find just by doing that and then getting rid of all those things that we talked about beforehand, the sugars, the sodas, the coffee, the fast foods, fried foods, alcohol, glutens, if you do that for a period of time, get salt out of your diet, and just watch what you're doing. See, what you're doing, there's only 3 things that cause anything: either injury to the body, biochemical imbalance, or stress. You have a couple things that are cooking there. And if you start watching that, bring it down. Where in Florida are you, Jess?
Boynton Beach on the East Coast.
Okay. Find yourself a really good acupuncturist to start with and a good chiropractor. And the combination of the two should help you bring that blood pressure down and bring it down quickly. In the meantime, do what I told you to do. Take the magnesium, it won't hurt you, and get a good B complex. Go to a health food store and ask them for a good quality organic form. Do not go to a drugstore or some CVS or anything like that, and see if that works. And if I can help you, go to our website, rosellcare.com, and drop me a note, and if I can be more specific and more directional for you, I'd be glad to do it. Jess, thank you for
that. I'm on my way to a health food store now, Whole Foods. They have all organic.
You bet. That's the best place
magnesium glycinate, you said?
Magnesium glycinate.
And I'll follow up with the other 2 therapies you suggested as well. That's wonderful.
Great, Jess. Let me know how it turns out. And, by the way, you can listen to us any Sunday down where you are. If you're near a computer, just go to WMAL.com and click Listen Live, and you can hear the program anywhere in the continental United States.
Great. You come highly recommended. I can see why. I'll be listening. Thank you.
Take care, Jess. Have a great day. Dr. Pina, let's talk about acupuncture with blood pressure problems, because I know you're going to touch on it this Wednesday evening, and relative to the modalities that you're using and how they affect different problems. So let's explore that a little bit, because we treat a lot of patients with high blood pressure with acupuncture. It's successful.
It is, and essentially it can be due to a number of different things when you look at it from a Chinese medicine perspective, and this is why acupuncture can be so effective. Is first thing, acupuncture always tends to relax a patient. As soon as they get over what's going on, and when you sit down and really talk with them and you explain to them how it works, essentially what it's doing is promoting more blood flow. So if your blood pressure is rising, essentially you could be because you're stressed out and your muscles are getting tighter. By relaxing the entire body, not just the cardiovascular system, it can help relax not only the blood going to the heart and throughout the veins and the arteries, but essentially also to those organs that require blood flow on a more significant need as well.
One of the things that I didn't ask Jess, and I would almost guarantee it, if he's had a blood pressure that kicks in that quickly, there's going to be problems with blood sugar, there's going to be problems with cholesterol and the blood pressure. It's called metabolic syndrome. And all those things kind of sneak up on you, and it waits for that last straw. It just, boom, all of a sudden it happens, and it looks like it came out of nowhere, but truly it doesn't. And with acupuncture, you can manage increased blood supply. You can open up heart circulation. You can open it up peripherally to the different extremities. And we're going to talk about that this Wednesday evening. You're going to be doing the class on acupuncture, actually beyond acupuncture, beyond the needling of acupuncture and all those modalities that are used. This Wednesday evening, the 26th, at 7:30 p.m. at our office at the Roselle Center for Healing. Dr. Stephanie Pina will be your host. and will be presenting a very interesting topic. I encourage you to attend. It is a gift. It is our presentation to you. Call our office at 703-698-7117. Tell my staff that you'd like to attend this Wednesday evening's program. She's sharp. She's accurate. She's very, very specific in her application, and I think that you're going to enjoy it. We're coming up to a break for news and very important information. You're listening to Dr. Tom Roselle and Dr. Tom Roselle Live. My guest in studio today, Dr. Stephanie Pina, who will be your host this Wednesday evening. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject. We're talking about acupuncture. Actually, acupuncture that is used in many different ways other than with needles. It's called Beyond the Needle, and that's the title and the topic of Dr. Stephanie Pina's presentation to you this Wednesday evening in our office at the Roselle Center for Healing. Dr. Pina is a licensed doctor of naturopathy and a licensed acupuncturist. We are very fortunate to have her as part of our armamentarium, our staff of very talented people. If you'd like to attend her class, 703-698-7117. That's 703-698-7117. This Wednesday evening, it's all for you. It's free, and all you need to do is make a reservation. We do require that piece of it. Dr. Pina, we're talking about acupuncture. I'm going to take the next call because this is right up your alley, and it's something that we treat all the time. Shirley, Temple Hills, thank you very much for calling. How can we help you?
Welcome. You're most welcome. Good afternoon. Delighted to talk to you, both of you and your guests. Yes, I have a list here for you. I have ringing in my ears, and it's a fullness. My head feels tight, and then I get these dizzy spells and lightheadedness, and I've suffered with vertigo since about almost 11 years old. It's been about 56 years off and on. But the ringing, it's just like that, and then sometimes when I get the ringing in the ear, I can feel like a mild vertigo attack of dizziness, and then my head feels so tight.
Okay, let me ask you a few questions, Shirley, just to kind of define this a little further. First of all, is the ringing that you hear, is it a high-pitched sound or is it kind of low-pitched?
May I demonstrate?
Go right ahead. Okay, so it's like a blowing sound.
Yes.
Okay, so it's not really a ringing because a high-pitched ringing has to do with liver function, and a low-pitched ringing actually sounds like a ringing has to do with kidney function.
Well, sometimes I do have, the normal ringing in the ear. I do, but this hissing sound that I have now, it's just
okay. Dr. Pina, you want to jump in on that one?
Nice demonstration there.
I know, that was great. That was, I recorded it. We're going to use it again.
Okay. We're going to put that one in the lecture and bring that one up there, too. Essentially, there could be a lot of different things going on. Sometimes it also sounds almost like to me, when you were just kind of giving our demonstration there, it sounded almost like there might be a little bit of a rupture into the ear itself, like the eardrum. Has there been any trauma or anything lately?
Years ago, when I was a kid, I had a tussle in my ear and someone jabbed it. But I've had the test that they insert water in your ear and you have the worst vertigo ever.
Right.
I've had that twice, and I've had MRI, and I've had CAT scans, and they all come back
negative. Shirley, when you get up from a laying down position to a standing position, do you get dizzy?
At times I do. I do have to watch it here lately since the ringing is like it is.
When you go outside and it's really, really bright outside, like a summer sunshine day and there's no clouds and it's really bright, do your eyes hurt? Not just the glare irritating, but do they hurt?
No.
Does it take you more time to adapt from outside when it's bright to inside when it's dark?
No, I have glaucoma. I don't have that. No, I don't remember. I can't say that I do.
Okay. That postural dizziness is something that has to do with the outer shell of a gland called the adrenal glands, and it's a small gland that sits on top of your kidneys. and it puts out adrenaline, and it puts out blood pressure regulating hormones, and it puts out things that handle blood sugars and so forth, and the list goes on, hormones and the like. And often when that system is depleted, and since you said it's been like that since you were a child, there's only a couple things that would come to mind very quickly. There can be others. One is that you have a genetic weakness of your fight-flight system, of your adrenal system, and or there was an injury when you were very young causing an instability of the upper portion of the neck and the lower portion of the brainstem. Dr. Pina, how would you differentiate those things relative to traditional Chinese medicine?
Well, definitely looking at the genetic issue, that tends to be, and the adrenal issue, it tends to be more of a kidney organ problem. So essentially what we'd want to make sure is if there's any other congestion locally, in that, like in the ears, any issues with allergies and stuff like that. But essentially what we'd want to do is try to work on addressing the adrenals and bring down the stress levels there.
Now, the adrenal system...
I had blood work done on the adrenal gland.
Blood work won't necessarily show it. You have to you have to take it at very specific times of the day. And one of the things that is the most effective test is something called an adrenal stress index, and it's actually a spit test. It's a salivary test, and you do it 4 times in one day. You do it in the morning, you do it late in the morning, you do it in the afternoon, and you do it before you go to bed. And it shows you the fluctuation of the stress hormone cortisol, but it also shows you the other many of the other pathways. It shows you DHEA. It shows you insulin, it shows you progesterone, it shows you IgA antibody response. All those have very specific paths. So what you want to see is, do these things, is your cortisol in the morning, it should be the highest of the day, is it high or is it down around your toenails? Is it crash in the afternoon, or does it get really, really high? Those are all things that would suggest different applications. But if you take one cortisol test at some part of the day, you really have, one, no comparison, and also the blood doesn't show you what's actually getting into the tissue, which salivary hormone does. So you have to look at other things. You also take blood pressure in postural patterns, sitting, laying, standing. That gives you another indication. There's also some other subtle tests that are done. So there's more to be done. And
I'm sorry. What did you exactly say? I could have had a trauma to my neck or something?
You could have had an injury when you were young. You could have had, and it could have stemmed back from the time you were born. You could have been forceps delivery. You could have been a breech delivery. You could have had trouble. Your mother could have trouble in one way or the other. You could have been dropped when you were a child. You could have fallen down when you were a child. You could have taken a blow to your head. Any of those things can cause the structural system not to be aligned properly. Then over time, sometimes not even in the initial stages, but over years, then it begins to cause problems. And it can cause problems like we're talking about. It can cause visual problems. It can cause, you said you have glaucoma. That's a increase in pressure, and it's usually, in our experience, has a lot to do with the inability of spinal fluid motion. Dr. Pina will tell you that it also has a lot to do with acupuncture situations where there's a damming, if you will, of the acupuncture energy. It's not moving.
Well, is there some herbs or something that I can take in the meantime?
Well, no, not without knowing your situation, because that would be dangerous.
Oh.
So we would need to know, because there are hot herbs and there are cold herbs and so forth. You can take magnesium and see if it'll bring it down. But with what we're talking about, you really need to be examined. I would encourage you, if you have the opportunity, come to the lecture on Wednesday night and then talk to Dr. Pina privately. She'll be there afterwards to be able to, to go over things individually.
Okay, thank you very much.
You're more than welcome, Shirley. Thank you for calling. If you'd like to attend Dr. Pina's presentation this Wednesday evening, 703-698-7117. That's how you tell my staff that you'd like to attend. Dr. Pina is a doctor of naturopathy and a licensed acupuncturist, and she's going to be talking about beyond the needle, beyond acupuncture and its traditional application and all the things that we need to do, but why it's important and how she can help you. Sarah, you've been waiting patiently. I'd like to take your call. How can I help you? Sarah?
Hello.
Hi.
Yes.
You got a question on LASIK, Sarah. How can I help you?
Yes, I was on LASIK, and I didn't put 2 and 2 together at the time. And I've been on it maybe 3-4 years. And on my face, I kept getting yellow patches. And I've gotten off the LASIK now, but this seems to be permanent, and it's embarrassing, you know.
Well, actually, that's it can be done. It's generally a result of liver function problems, particularly if it's underneath the eyes. LASIK has a whole bunch of side effects, rashes and hives and itching, difficult breathing, it goes on. It can actually go into cardiac failure under the right situations. You can cause some bleeding, there's burning, there's tingling, there's dizziness, there's shortness of breath and dehydration problems, kicking up potassium, blood sugar problems, nausea. I mean, the list goes on and on and on and on. And